Last semester ended. I had the week off, ended up going on vacation, and I actually started my clinical rotations 2 weeks ago. I just finished my second week, and just as a quick reminder, for my respiratory therapy program, my clinicals are 3 days a week, 12 hours each day. And then I do go to the school 1 day a week for lab, and that will go on for about 7 weeks. And then once the 7 weeks of clinical has finished, I will do 10 weeks of classes. So I just wanted to share a couple of things that, some thoughts I've had about clinical and some of the things that I've been trying to implement so far. If you guys do anything different, or if you have any suggestions, tips, or just want to share what you do or how your clinicals are going, definitely feel free to let me know down below and let's talk about it, okay? First thing I think is really important is to stay positive. Be eager to learn. I want to see everything. I want to know where everything is. I want to know what it does. I want to know all the different departments and where they're located. So if you have a chance, even if someone just wants you to bring something to them, do it. You're going to learn the hospital a lot faster, which right now is kind of like a giant maze when you get past the main lobby behind everything. So I'm still learning that. But definitely stay positive. No matter how many times you've done something, do it one more time. See how other people are doing it. Make sure that you do it as many times as you can to become proficient at it. And then also, I think it's very important to stay positive because, let's be real, especially if you're in a hospital, you're going to see things that you've most likely never seen before if you haven't worked in a medical field. You're going to see death, you're going to see people that are sick, you're going to see sadness. You're also going to be there to witness happiness and healing. You're going to be there for all of these things. So it's a lot of new things. So you have to keep in mind, if you do see something that is new to you and maybe startling, or that you might think is sad, try to stay positive and keep going, because you can learn from every single experience. A lot of people, from what I understand, talking to classmates and other people, and even myself, trying to look at things from a clinical perspective also does help getting through a lot of those new experiences. If you can also look at it from a clinical perspective that obviously still have the human touch in there, it's going to make sure that you are doing the right thing for your patient and doing the best thing possible to help them get better, or help their family member through something that they are experiencing as well, along with the patient. Next thing I want to bring up is making mistakes or getting questions wrong on clinicals. Again, I'm not an expert by any means. Obviously, it's my first clinical rotation, and I was very nervous my first week, so I would get questions wrong when asked, or sometimes I would get asked a question, and when someone would start to explain it, a light switch would go off in my head, and I'd go, oh, I do remember this. Oh, why didn't I just blurt that answer out there? And you kick yourself a little bit. But I think the most important thing to do in those situations, if you have a question or you get asked a question that you don't know the answer to, you can either discuss it with your preceptor, or something that I also do if, once we finish rounds, if there's nothing going on, or if I have a second in between, I will pull out my pocket guide and look up whatever I can. If it's not in my pocket guide, I will get my textbook, which I do bring with me as well, and I'll try to find the information there, because you have to be eager to learn. Even if you get a question wrong, you have to be eager to learn from your mistakes also, because if you want to be a good professional, you need to be able to, as they say, roll with the punches. You get a question wrong, you need to be positive and keep going and still be able to show that you were able to learn from that mistake. I look up anything that I get wrong, and I will go back to that preceptor and tell them, hey, I looked this up, this is what I found, and if I have any additional questions that my book isn't able to answer, I'll ask them also. Something else that I have started doing, because pharmacology was a really rough course, and there's so many medications you go over, and each hospital is different depending on the type of patients that are there a lot. You may see certain medications more than others. So once I find out what medications we'll be using that day, I will actually write down what they are, what they do, and then common dosages. And then also, let's say, for example, I'm giving a treatment with Duoneb. I'll write down the combination medication. I'll write down that it's ipratropium bromide and albuterol, and then what those two things are separately as well, why they're combined, to try to help me remember. Because the more I do that, even if I have 10 patients on Duoneb, I'll write it down every time, because the more I write it down and the more you come into contact with something, the quicker you're going to remember it next time. And it's also good for the occasions when you do come across a medication that you haven't seen before or maybe is not as commonly used. Also do the same thing there. I have started trying to do the same thing with disease processes. There have been a lot, so that's a little bit more difficult to try to study all of them in one day, but I'm trying to go through, lists of different processes that I run into most often or want to learn more about. So I'll take anything I run into that day, write it down, and those ones I usually have to study when I get home because it's a little bit of a lengthier process. So I do try to, go over any of that information and study any of it. Now, regarding my clinical site, I have gotten really lucky. Actually, the location I'm at is a really good group of people. They all work really well together, and when I do get something not quite right, no one yells at me, no one gets really angry at me. They let me know, like, hey, this is what the answer I was looking for was, or this is what I would suggest, or go look it up for me and let me know what you find and we'll talk about it. And also they're all really great about if I'm with one preceptor and someone else on a floor close to us has an interesting case or is doing something that they think I might be interested in seeing, they'll let my preceptor and I know so that I can go observe whatever is happening, which is also really great because it lets you know that it's a really great teaching hospital and everyone works so well together. I've been in certain situations where there are so many people in the room and it's like they all know exactly the next step the person's going to take. It's just, they're a really great team. So I got really lucky to be able to see that in my first rotation also, which makes the learning experience even better to see how well a functioning team works together and how it should look. So I got really lucky there. But basically, that's kind of it so far because like I said, I'm only 2 weeks in. And for anybody that has just started the program or their clinicals, please let me know how it's going down below. If you guys have any questions for me, definitely leave them. I'll get back to you as soon as I can. I've been trying to answer comments and questions as time goes, but my schedule's a little bit different now, so I'm sorry if I don't get back to you guys right away. But I hope everybody's doing well, and I guess I'll see you guys next time, okay?